Haslam is here. He's Program Director of Addiction Canada. Thanks for joining us.
Morning.
Good morning.
What we know now is that Rob Ford has admitted to using crack cocaine. He has also admitted to being intoxicated in public on a number of different occasions. I wonder, obviously you have not treated him or sat with him, but I wonder, from your years of experience, as you look at behavior patterns, are these patterns consistent with the patterns of someone who is fighting an addiction?
Yeah, that's a great question, mainly because I cannot speak for Mayor Ford, but certainly certain pages can be taken out of his response that the media has asked him. For example, May 24th, when he mentioned he had denied use. Some of the behaviors or some of the statements that Mayor Ford had made, such as he did it in a drunken stupor. The irony of this whole drug addiction is that alcohol and crack go very much hand in hand. So that is one of the things I see. The other is a denial. There is always denial when someone's using, and that comes out of many other things, such as shame, guilt, feeling it very hard, and especially with someone in the public domain, it's even harder to admit to it. But the positive out of this whole situation is that I've got to give the mayor credit. Courageous in admitting it, courageous in the fact that he has been very forthcoming in the fact that how all this transpired. These are things that are indicative of crack use.
Can you talk about what the drug crack is?
Yes, crack is one of the most highly addictive drugs out there. And it is a stimulant. It comes under what is called a stimulant. 5 to 30 minutes after use, you get a very, very euphoric feeling. It is very addictive. However, at our center, where we treat a lot of crack users, people who use crack, there's always that component of what is the term polyusers. So you're never just using crack. You're always using something in addition to using crack, and usually it's alcohol, and it could be a variety of other drugs.
Okay, let me ask you then. Rob Ford admits to smoking crack once. We don't know if that is true, but
Right.
Can you be a recreational crack user? You mentioned how addictive this is.
Right.
How problematic is that?
Well, recreational use is something that I've experienced with a lot of our clients, and we just use it for recreational. Using any kind of drug is Russian roulette because it affects each one differently. Our makeup, the amount of use, all of that goes into how quickly one can be addicted. There's the environment, there's a whole lot of issues that go into whether using it once or using it more than once. But regardless of the fact, using it once is what I like to refer to, use the analogy when you see a cockroach on the counter, you know for sure there's a whole lot hiding elsewhere. The same thing with using drugs. Initially it's always hard to come out clean and say I'm using it. But in these incremental truths that have come out from the mayor's statements, I tend to think that there is a very high possibility that anyone who's using drugs and saying it's recreational, I would caution to take a second look at that belief.
Robin, you say that you have to give the mayor credit for coming out for saying that he did use drugs. I would like to know what you think is the bigger problem. Are they both equally as bad, using drugs or abusing alcohol? I mean...
Yes. In my own professional belief, we cannot differentiate between drugs. Anything that is a mood-altering substance, if it's affecting you in any way, that's a problem.
You got a problem.
Yes.
I have to ask you for just a yes or no answer because we're out of time, but in your experience, can you fix an addiction problem yourself without any kind of professional help, typically?
The straight answer is no.
There you go. Thank you, Robin Haslam. He's the Program Director for Addiction Canada. Thanks for coming by this morning.
Thank you very much.
8:10, we'll be right back.